Hey guys, so this time एक और दिन एक और नया gazette from NMC, and to be very frank, this time I did not in my heart did not want to make this video because every day we are getting something new. But I got so many questions that I thought let's go point by point and let every student understand what this actually gazette means. And I'm telling you in the very start of the video, I am totally against this NMC policy. They are acting as if the exam is in 2026. They are acting that it's just a brainstorming session. Every day we are getting a new clause, new rule, and it is just causing confusion. So in the very start of this video, if anyone from the government of India is watching, consider this my plea on the day of Doctors' Day, that if you really want to respect our doctors across India, if you really want our doctors to have a pride in being Indian, please have some mercy on their minds. Because every day this new rule is just causing anxiety, is just causing more confusion, and trust me, nobody in the whole country knows what is the real answer. All right, and even after this gazette, we are not knowing any kind of answer. It is just causing another open-ended debate, which of course we'll have to wait for further notifications. So guys, let's go point by point. I'll try to give you as much clarity as possible, but please, until and unless we hear the word final clarification from NMC, please consider everything that is being done in today's video as a probable work. So talking about the definition, everything, I think you already know that. General, it is basically an eligibility criteria now. Okay, next is basically an eligibility criteria now. If, for example, next is what? Next is basically a licentiate exam. If you cross next one, you will get the provisional degree of India. If you cross next two, it will be the permanent degree of India. The one thing is clear in this whole gazette is that it doesn't matter whichever degree you want to pursue in the whole world, PLAB, USMLE, IS, everything. But if as a student, if you want to get registered in the Indian Medical Association, I won't say association, I would say the Indian Medical Register, then you have to pass next one internship and next two compulsorily if you want to be registered as an Indian medical practitioner. So it doesn't matter whichever degree you are going to go ahead with. For an Indian license, next one internship and next two are compulsory. Now moving on to the following shall undertake the national exit test, all UG students of India, all FMG graduates fulfilling the requirement of foreign medical graduate and regulations by NMC. Now a question arises that many students in FMG are basically going abroad without qualifying NEET. Alright, I'm getting many queries like that. Guys, till now, as we can see in this thing, that if your college is registered under MCI, you can very well go ahead with this examination. Okay, but again, this is what it is listed here. So any other person with a medical degree for purpose such as pursuing an academic course, observership, or any other purpose may be specified and approved by NMC. I believe that this means USMLE, PLAB and other courses, or maybe the courses that are specified by NMC. Let's wait and watch on this one. All those who have been granted a license to practice. Now this, my friends, is a very open-ended word. Does this mean interns and post-interns? Basically what they are saying is that any MBBS graduate who has already done MBBS will also have to give next only. So we need to have a clarity, big time clarity on this one. This is what they have written right now. I do not have a clear answer on this thing, but I'm giving you a question mark that this is something that every intern and post-intern needs to look forward to. The Commission shall specify from time to time by appropriate regulations or notifications the applicable manner. ये किसी काम का नहीं है. Okay, listen to this one. It is implied that whenever NEXT is enforced, the corresponding equivalent existing examination, that is NEET, shall be phased out. This was the old one. This basically says that whenever NEXT will happen, there are chances that NEET PG might continue or it will be gradually phased out. So that also means that NEET can happen for interns and post-interns. Although again the clarity is not there, but there are 99% chances that interns and post-interns will go forward with NEET PG only, and the 2019 batch, the final year, will go with the next one exam. All right. Now listen to this as well. However, if the previous batches, the existing examinations are applicable as may be decided by the Commission, then the existing examination shall continue for such time as deemed appropriate to the Commission, with the understanding that next shall eventually replace the corresponding equivalent existing examination. The use of scores and normalization of different examination in next, when applicable concurrently, for such purposes as it may be appropriate, shall be determined as and when necessary and notified by Commission. So it states that the one day when next and NEET happens simultaneously for the same batch of students or for seniors and juniors, then normalization will take place, and that shall be decided by the NMC in further steps. Talking about next one, all we know, we are very clear with that, but I'll give you a quick recap. Next one is a theory examination, shall be one or more than one type of multiple choice type questions. It will be a single correct answer type. The examination shall be conducted through a CBT method. Okay. Now the 6 papers, we have all covered those. It is going to have medicine and allied disciplines, surgery, OBG, PEDS, ENT and ophthalmology. For all the students who have completed the third and final MBBS course of a medical college approved and recognized by Commission shall be eligible to appear in the examination. There shall be a regular next step 1 examination held twice a year in the months of May and November, or any other time as may be notified by the Commission. Again, a big question mark. There is no restriction to the number of attempts in next step 1, provided the candidate has passed both next step 1 and next step 2 examination within 10 years of joining the MBBS course. Now, what do they mean by this step? They are saying that within, for example, if you are a 2022 batch student, you need to have a 50% passing score in both next 1 and next 2. You have to pass the examinations. Okay. Next one also has the secondary work of being a PG entrance examination. So let's suppose that you have crossed next 1 and next 2 both as a passing percentage. Now in your further upcoming years, for the next 4 years till 2032 or further itself, you can appear for next one as many times as possible to be your PG entrance examination. But you have to qualify as a passing percentage next 1 and next 2 before 2032. Now this is again, you can call it fair or unfair practice, but it is basically कि अगर आप 7 बार फेल हो चुके हो एग्जाम के अंदर तो आपको वापस से पूरा देना पड़ता है. So this is what they are saying is that if you are not able to pass next 1 and next 2 within 10 years, you may have to do MBBS completely from the very first day. There is no restriction to the number of attempts in the appear of next step 1 to improve score, provided these examinations for improvement of score are taken after completion of next step 2. Candidate is not entitled to appear in next step 1 for improvement of score till completion of next 2. So if you have given next one right now, you will be giving next 2. Now you want to simply give the exam again as a PG entrance exam. You cannot give it before next 2. You have to wait for completion of next 2 to again give the examination as a re-attempt in the PG entrance. The next step 1 shall replace the conventional university theory examination, third MBBS, final MBBS part 2. So basically they are now getting to the AIMS pattern where it will be first prof, second prof, then there will be no third prof. It will be basically internal examination inside the colleges, and the main exam shall be the final professional, which is being replaced by the next. And next is going to count for the third and final professional. It will be the licentiate exam, it will be the exam to get a provisional degree, and your main PG entrance examination. Talking about, okay. Practical and clinical examination shall continue to be held conventionally unless otherwise notified by the Commission. What they have also said is that post next 1 examination, before start of internship, you will be having your third and final practical as well. But which I again say it's an unfair. If you're already taking next 2, which is again a proper practical examination, you could have simply skipped this exam. But I'm not even against that. It's a policy that is being done by the NMC. So I think this is something we can still get used to. Talking about next step 2 shall be a practical, clinical or a viva voce examination. Now, apart from the 6 subjects of next step 1, they have added orthopedics and PMR. All right, so that this is orthopedics and PMR. So if you have a very good orthopedics department in your college, university, please be thankful for that. The examination shall be objectively structured, clinical case-based, simulated case patient aimed at evaluating practical clinical skills, clinical decision-making and communication skills expected in an Indian medical graduate. Basically, in simple words, they are going to test whatever you have learned during your internship, and they are going to ask the same things in next 2. The examination shall be held in person, shall be conducted by the respective state-held university institutions, following the standard and guidelines provided by the Commission. Wherever state-held universities do not exist, the Commission shall decide on the university institution authorized to conduct next step 2 for respective colleges. There shall be a regular next step 2 twice a year. This is also a new point, guys. Earlier it was stated only once a year, but now it is going to be twice a year. The next step 2 supplementary examination shall be held twice a year, and do note this is basically a googly and is restricted to only those candidates who have failed in 1 or more of the 7 subjects and are required to repeat subjects. If the candidate, this is the main point, if the candidate fails in more than 3 subjects, she must appear in all 7 subjects afresh in supplementary examination. What they mean is that if you fail in less than 3, then you will have to appear in only those subjects in which you have failed. But if you have failed in more than 3, then you have to appear in all the 7 subjects, again in the step 2 suppli examination. There is no restriction to the number of attempts in next step 2, provided the candidate has passed next 1 step 2 in 10 years of joining MBBS. Nature of scoring. Let's understand this. The marks of next step 1 shall be calculated as a whole number, which shall serve as the raw scores with appropriate decimals and subsequent corresponding percentages. Basically, marks out of maximum of 100 with appropriate decimals shall be counted. Your 6 parts of the examination, score of all the 6 parts shall be added up, and that final score shall be your main raw score for PG entrance and other purposes. Next 2 examinations shall be declared only as a pass and fail examination based on your performance in that practical and viva voce. Now we come to minimum scores to pass. Now they have given some kind of clarity that how a student can actually pass in these examinations. So what they are saying that the minimum marks for passing shall be 50% or half of the maximum possible raw score for next step 1. Now they have given a simple explanation that let's assume there is a student who basically out of the 6 passes in 2 but fails in 4. Now he or she shall be given another chance in the next coming examination, which can be May or November. If he or she again passes in all 4, he or she shall be considered as a student who has passed next 1 examination. Now let's suppose in that next examination, he or she again fails in 2, passes in 2. Then in the 3rd examination, he or she will again be given a chance to qualify, or if he or she gets a minimum passing marks, he or she shall be considered as next step 1 passed student. So this is what they are saying in this particular examination. 3rd, calculation of next step 1 scores for determining merit of purpose of admission to postgraduate courses in broad specialties. Please listen to this very carefully. For the purpose of determining merit for admission to PG courses shall be calculated from the sum of raw score obtained in each paper subject in a single next step 1 examination only. So for example, if you're giving this next one, you might have failed in 2 subjects. You shall qualify those 2 subjects in the next exam cycle, but your raw score for PG entrance examination shall be considered from the last attempt only. Alright, for determining merit for admission to broad specialty PG courses shall remain valid for the next 5 years. However, if the candidate appeared in next exam cycle of next step 1, then previous next step 1 score shall be invalid for determination of rank for admission into PG courses. And only last attempt of next step 1 score would be considered in determination of rank. So, whenever you give all the 6 subjects together, the last attempt of all those 6 shall be counted as your final raw score. and this raw score shall be valid with you for the next 5 years, and only this score shall be counted for the PG entrance examination. Your previous score shall basically be cancelled. Now this is a very good step, guys. They have removed average scoring, which is basically something that good has happened. Otherwise, average scoring would have never allowed a person, for example, if he has performed bad in the very first attempt, if he performs even the best in the next attempt, then the score will be balanced like this. So that particular average scoring would have never given a chance to rise. But this again is like a basic competition exam. So I respect NMC for getting this thing done. To determine rank for admission into PG courses in an academic year, the candidate needs to apply generation of rank in a manner as prescribed by the Commission. Only those candidates who have applied for generation of rank will be entitled for admission. So if you do not want your rank to be generated, you can simply say my score is valid. For example, let's say the X score is there. That X score is with you for the next 5 years. Now, for you as a student, you want, okay, do I want my admission in this admission cycle? Then you say, okay, generate my rank, and then you can sit in the counseling. You want, okay, abhi nahi karna mujhe, I still have to wait. I want to try for USMLE, I want to try for IES. Then my friends, you can very well go ahead and say, I do not want my rank right now. I would try again next year. Next year, you can go to the commission and say, please generate my rank. So whatever rank would be possible at your score in those admission cycle, you will be then entitled a seat in that process. I hope that's clear. Now, tiebreaker rule for generation of rank: the normalized sum of raw score obtained in each paper subject in a single next one examination. Method of normalization of sum of raw score for across next step 1 examination cycle will be notified and when necessary by the Commission. So normalized score is basically something which is not justified, basically not clarified by the NMC right now. The candidate with lower attempts of next step 1 will be given a higher rank. I have given 1 attempt, you have given 2 attempts. You might have so we have an equal score, but I will be given a high rank. Candidates with higher marks in following order of preferences will be given higher rank. If you have got more marks in medicine, if you have got more marks in surgery, it will be second, obs gynae, pedia, ENT and ophthalmology. This is the score. So any student who has got in a tiebreaker, if you have got same attempts, I have got the same attempts. If I have got more score in medicine, then my friend, I will be given a higher rank. Utility of NEXT score. This is also important because they are now using NEXT as basically your in your resume as well. So if you are applying anywhere in the whole country, your NEXT score can be considered as a statement in your admission in those courses, jobs or any other thing. So eligibility of Indian medical graduate for provisional registration to pursue internship. Your NEXT score shall decide if you can start your internship or not. You have to pass in each of the 6 theory papers to start internship, and you have to pass in your practical of third and final as well. So this is practical, this is the theory examination. Eligibility of FMG for provisional registration to pursue internship as governed by compulsory rotating medical internship regulations 2021 out of NMC. So if you are a FMG, you need to clear next one to start your provisional internship here in India. A medical student who has completed undergraduate medical education overseas and has fulfilled the applicable requirements provided by FMGE of the Commission shall be eligible for compulsory rotating internship. Please note the word compulsory. So that means if you are doing your FMG from any country throughout the world, you have to, if you want to enter into India, then you have to do next one, internship and next two. And you have to clear next one to start internship in India, which is again compulsory for every FMG. So it doesn't matter whatever is happening right now, your internship might be considered, but from now on, when next happens, your internship will not be considered. You have to appear for internship in India. You have to pass in each of the 6 theory papers of next step 1 to basically be eligible for compulsory rotating internship in India. Eligibility for grant of license to practice modern system of medicine in India, and eligibility to be registered in NMC for further practices. So, if you are an Indian medical graduate or a foreign medical graduate who shall be eligible to be registered as NMC, National Medical Register or State Medical Register, in that case, what you require is you have completed the appropriate duration of internship in India. You have passed the next step 2. You have fulfilled the requirement as per registration of medical practitioner license to practice medicine regulations of the NMC, any other requirement that may be appropriate by the NMC. So this is what I have just summarized. You want to be an Indian medical registered doctor, you have to cross next one, internship, and next two in India. Now, eligibility for admission to postgraduate medical courses in broad specialty. For that also, you need to make sure that you have crossed next step one, internship, and then next two. So I'll just read what they have written. Okay, so see, this is what they have written. He has been eligible and granted license to practice modern system of medicine in India. He has participated in manner of common counseling. All those who have been granted a license to practice and are registered in an NMC before the commencement of this regulation and who wish to take admission to a postgraduate courses in broad specialties need to appear in next step one only. This is something which needs to be clarified, but I'll try my best to do so. For all those who have been granted a license to practice and are registered in NMC, this is basically interns and post-interns, people who have done MBBS graduate. Okay, before the commencement of this regulation and who wish to take admission to a postgraduate course in broad specialties need to appear in next step one only. So this again basically in a subtle way says that interns and post interns might have to give next one only. So I request NMC give us a clarity कि interns के साथ क्या होने वाला है. But to my understanding, I would still say 99% NEET PG will happen only for you guys, so you don't have to worry much. Utilization of next score for the purpose of any purposes other than above. So do understand this. This basically says that your resume will have your next one score in it. All right. So if you have got a very good next one score, there are very high chances that in your 5-year, the validity that you have, for example, I gave the exam in 2024. But I'd say that I don't want it right now. I don't want my rank right now. I simply want to work as a plain MBBS, try for other courses, maybe, try for some government jobs, projects. So my next one score shall be the one big thing which will increase my chances of getting that admission or job. So this is what they are saying. MBBS degree will be awarded after passing of final MBBS and successful completion of 1-year internship. Perfect. Now, the objective of next step one, let's go through that. I think everything we have been done. Next step one, distribution of items, levels of questions to ensure assessment of higher domains of medical learning. Next step one format is intended to discourage rote learning by medical students. Now, this one thing that I can very, very confidently say at Bhatia, we have been teaching for last year, complete year. And even in eGurukul, the complete recording has been made like that. Because we very well knew that next is about to come, either this year or next year, but next will be there. And the whole conceptual base of learning doesn't matter in next only. Even NEET PG is a very well conceptualized exam. They are very well on the way to make sure that rote learning is not there. So whatever we are doing right now, it is based on next based curriculum only. And why many students are asking me, sir, why are you not increasing pediatrics? A 3-day pediatric system is based on what? Is based on this thing. The must-know factor is 60%, and the first 2 days are completely based on the must-know thing only. The last day is focusing on nice to know and may to know. You may know basically. We have to prioritize your education in such a way that you can very well go ahead, revise, read, and make sure that you complete all the MCQs. So what QBank that we are working on, it will be launching in next 15 days, the complete QBank. It's completely based on this level of problem solving, comprehension and recall based only. All right. We have also put some single learners as well to make sure that the whole complete QBank gives you a one-end solution system. But do understand that it is not just for NEXT, it is for NEET PG as well. They are also asking case-based studies. So don't get worried about this next. Focus on gaining your concepts. Once your concepts are complete, whatever the exam that you're focusing on, you shall be able to crack that. And we at Bhatia know what to do. All right. So one thing that you can really trust us is, I'm just a spokesperson here. There's a whole team of academy people who have designed this. So one thing that you can really focus on is that curriculum and syllabus is the priority for us. Okay, so this is the exam. I think I will not go through the next one examination. That day, that thing is already done. Next two is something which I'll just tell you about the whole thing. That this is the proposed timeline. Let's talk about this thing. So next step one, the proposed timeline is May and November for the examination. Result in first week of June and December. Practical in first week of June, basically a month after. Then the result in third week of June and December. Internship in 1st January, July, 2 entry points of internship. Ending will be 31st of December or 30th June. Next step to regular, third week of June and December. Third week of June and December. Fourth week of June and December, there will be the result. Next step to supplementary, first week of September and March. Result shall be on third week of September and March. Postgraduate admissions will be May, June and 30th June. Postgraduate courses shall start from 1st of July or first week of January. So this, my friends, is the this is the final next gazette. I hope I've been able to clear everything. If you want to talk to me more on this thing, so this is my Instagram ID, dr.Nachiket Bhatia. I try to answer every question that I get, but do understand right now the number of queries is humongous. So I'll try to answer most of your queries, but please go through this thing. It will really help you understand what the government has planned for us. So best of luck, and I stand with each and every student of India to basically make sure that you are treated fairly. That's me, and always remember, Bhatia hai to bharosa hai.